Thank you for your attention. I have nothing to disclose. Proximal gastrectomy is considered less invasive and more function-preserving than total gastrectomy for up to 1/3 gastric cancer because the distal part of the stomach is preserved. Reconstruction with double tract is emerging method for proximal gastrectomy, but its effect on quality of life of the patients is unknown. This is the first study that evaluates the quality of life of patients who underwent LPG with DTR compared to LTG by propensity score matching. This was a retrospective review. 324 patients and 280 patients underwent LTG and LPG, respectively, between 2013 and 2018. After propensity score matching, 31 patients in each group were analyzed. There was no significant difference in every factor before and after matching. The number of retrieved lymph nodes were significantly larger in LTG group. The LTG group had a higher level of WBC postoperatively during hospitalization. There was no significant difference in postoperative complications. There was significant difference in vitamin B12 levels within postoperative 2 years. Vitamin B12 was more frequently replaced in the LTG group. Despite requiring more replacement of vitamin B12, LTG group was significantly more probable to be deficient in vitamin B12. No significant difference in nutrition parameters within postoperative 2 years. Next is the results of comparison of quality of life over time between two groups. There was no significant difference in global health status and 5 functional scales. There was no significant difference in symptom scale except for nausea, vomiting. It has less occurred in PG group. There was no significant difference in post-gastrectomy symptom-related scales within 2 years after surgery. In addition, we calculated the percentage of food inflow to the remnant stomach using the radionuclide media, and that percentage significantly increased over time. We also analyzed the correlation between the percentage of food inflow and quality of life symptom scales. Fatigue and pain were positively correlated to the food inflow at 4 months after surgery, and nausea vomiting was negatively correlated at 12 months after surgery. There was no significant correlation in these factors. In conclusion, the LPG with DTR showed better quality of life with comparable surgical outcomes and complications over LTG and helps preventing vitamin B12 deficiency. Thank you for your attention.